is Miss Stevens. I'm here today to do my skeleton exam. As you can see, I have a nice purple background in my skeleton. So let's get started. The frontal bone forms the forehead. It also forms the front part of the skull and the upper eye sockets. The parietal bone forms the side and the upper back part of each side of the skull. It meets the frontal bone. The temporal bone, which is located at the lower sides of the skull or directly underneath the temple. These are facial bones. The occipital bone forms the back or the base of the skull. This bone does not pair with anything. It articulates with the cervical spine. Sphenoid bone is a butterfly-shaped cranial bone that's located between the frontal and the temporary bone. Ethmoid bone is also a cranial bone that's located at the top of the nasal cavity. The mandible is the jawbone. It's actually the lower jawbone. This is considered the only movable bone in the skull. It's also considered the strongest bone of the face. The maxilla is also a jawbone. It forms the upper jaw. It makes up the roof of the mouth, the floor of the orbits, and the nasal cavity. The palatine bone, it's located in the roof of the mouth in the back. The zygomatic bone are molar bones. They help form lateral walls of the orbits. The nasal bone forms in different sizes. This forms the bridge of the nose. The lacrimal bone is located in the middle of each eye socket between the ethmoid and the maxilla. The vomer is a small bone separating the left and right nostril bone. The inferior nasal concha, it separates the two nasal cavities. The hyoid bone, which is also the throat bone, is a horseshoe-shaped bone that's in the middle of the neck, which is between the chin and the thyroid cartilage. The shoulder bone connects the upper part of the arm to the collarbone. The trapezius is a muscle implant into the collarbone. It's responsible for movement of the head and shoulder. The collarbone is a long and thick layer located at the base of the neck. The function of the collarbone is to support the arm. The sternum bone, which is also known as the breastbone, connects the two sides of your rib cage together. It sits in front of your heart, lungs, and stomach. The ribs, there are 24 ribs, 12 on each side. The bones are long and curved to connect to the spinal vertebrae. The first 7 are true ribs that are connected to the costal cartilage. The other 5 are not, but are known as false ribs. 3 of the false ribs connect to the non-costal cartilage. The other 2 are floating ribs, which mean they only connect to the spine. The cervical vertebrae, there's 7 in the body. C1, which is the atlas, and C2, which is the axis. They allow movement of the head. The thoracic vertebrae, there are 12 of them. They are medium sized. They do increase as they go down the spine. The lumbar vertebrae, there are 5 of them. It supports the weight of the upper body. The sacrum vertebrae, known as 5-fused vertebrae, is an upside-down triangle. It articulates with the pelvis. The coccygeal vertebrae is a small bone. It articulates with the apex of the sacrum. The humerus is a bone that forms the upper arm to join it to the shoulder and the forearm. The radius is a long bone on the forearm. It lays parallel to the ulna. The ulna is a long bone in the forearm. It lays parallel to the radius. The ulna helps the radius with movement. The scaphoid bone. This carpal bone surrounds the area of the wrist. It's the most common carpal bone to break. The lunate bone is the base of the hand. As you can see, it's located between the pinky and to the right of the scaphoid. The triangular bone does not articulate with the ulna bone. The pisiform main function is to protect during movement. The trapezium rests between the metacarpal of the thumb. The trapezoid bone is the smallest bone in the distal row. It sits between the trapezium and the capitate bone. The capitate bone is the largest of the carpal bone. It lays between the trapezoid and the hamate. The hamate bone is a wedge shape. Hamate means it connects with other bones. The metacarpal bones. There are 10 of them. These are long bones within the hand that connect to the wrist or the finger bones. The top of the metacarpal forms the knuckles when they join to the wrist. The proximal flings is the closest to the metacarpals, 3 located in each long finger and 2 in the thumb. They help form the knuckle joint. Intermediate flanges. These bones are located in the fingers. Distal flanges. These are fingertips. On top of the fingertips are the nails. The hip bone, which is also the pivot bone, is very large and flat. That's located in the center. Ilium is the largest of the hip bone. It's divided into 2 parts, the body and the wing. The ischium forms the lower and the back part of the hip bone, below the ilium and behind the pubis. The pubis splits the pelvis in half. The femur bone is the only bone of the upper leg. All of the body weight is supported by the femur. The patella is the kneecap. It protects the knee joint. The tibia is the shin bone. It's the strongest bone of the leg. It's the strongest long bone because it supports the rest of the body. The fibula is the smallest bone of the leg. The calcaneus is the largest torso bone. It forms the heel. The talus is the ankle bone. The navicular bone is an extra bone located on the inner side of the foot just above the arch. The medial cuneiform bone is the first cuneiform. It's also the largest. They are located between the metatarsal bones and the navicular bone. The intermediate cuneiform is also known as the second or the middle. It joins to the bones of the second toe. The lateral cuneiform is the third cuneiform. It's a wedge bone that's in the distal row. The cuboid bone is a cube shape that connects the foot to the ankle. The metatarsal bones. There are 10 of them. They are toes. The proximal phalange is the largest bone of the toe. It forms the base of the toe. The intermediate phalange are the smaller bones of the toes. The distal phalange are the bones at the tip of the toes. So that concludes my skeleton project. Thanks for watching.